Hey everyone, welcome back to Urology 101. I'm James Farrell. Urology 101 is my video blog on common topics in urology that are often taboo or embarrassing, just simply because we deal with sex organs a lot. Now, my content's focused on communicating some useful medical knowledge to you, with my goal of providing you some practical advice that you can apply at home. This video and all of my other videos can be found on my website, which is urology101.com. The first part of that is spelled Y-O-U-R. All the videos are also on our YouTube channel, which is spelled the same, Urology 101. And I post daily on Instagram, or at least most days. I'm getting back on the horse with that one. But great content. Check it out. A little different from the video format. Same name, Urology 101, spelled the same. With that, let's kind of get on to today's topic. Now, most people at some point in their life are going to have surgery. And maybe you, a family member, or a friend have one coming up. If that's the case, please share this with them or watch it, and I hope that it's really helpful. If you had surgery recently, especially if you had urologic surgery, then hang out, fact check me, and let me know how I've done with some of the post-op care, all right? Because while there are going to be specific things that your surgeon wants you to pay attention to, and that certainly was the case when I tore my ACL and had it reconstructed a year and a half ago. Slept with a big clunky brace for a month, did thousands of straight leg extensions. I'm really happy I did because it went really well. My outcome was good. That's all I cared about. That's all my surgeon cared about. And that was specific to that surgery. But there are plenty of things that we talk about that are really general, that are involved in a lot of cases. And the same types of questions always come up. And 2 or 3 days after surgery, when I talk with my patients, they always have the same questions about, whether their incision looks okay, like what's this bruising or what's this random shooting pain, and what should I do about these pain medications. We talk about this stuff before operations, but it's easy to forget it all. It's a lot of information. And more often than I probably care to admit, I'll get an unannounced scrotal or dick pic on a patient who I operate on who just wants to know that things look okay. And it's a little odd to be an expert in that area, but if they're concerned about it, I'm really glad that they're getting in touch with me just so that we can sort it out. And that sort of drives home the point that there's not a great resource out there about some of this stuff. So let's talk about incisions, let's talk about some swelling, some pain medications, and hopefully all this stuff is helpful. So starting off with incisions, if your surgery has an incision, it's probably going to be closed in one of 3 ways. So it's either going to be with staples, you're going to have some sutures under the skin and you're going to have some glue on top, or you're going to have sutures that you can see that are dissolvable. Now, any incision usually can be wet and washed in a shower or something like that within a couple days. So do check with your surgeon on that, but usually I'll say 1 or 2 days. And soap and water is fine. It can wash over the incision, and then you can pat it dry. I don't want you to rub back and forth because that might pull the edges of the incision apart, but soap and water and patting dry is just fine. Now, most of us do not want you to be in a hot tub or in a bath or swimming for a few weeks until that incision is really well healed up, because submerging it and keeping it underwater is going to allow those edges to sort of separate, and nobody wants hot tub water inside their incision. That's just a recipe for infection. So really stay out of that type of situation for a few weeks until it's well healed and somebody said, yeah, it's good, go ahead and do that stuff. That's going to be your safest bet. Now, overall, incisions heal best when they're dry. So after a day or two, you probably don't need Band-Aids or gauze or things like that unless someone has told you differently. But in general, things heal best when they're dry. Sometimes I'll have guys come back and they will have just like caked on Neosporin or bacitracin over something, and I think maybe they're hoping that there's some magic where it's going to like cause this thing to heal together and just seal up really quickly. And unfortunately, that's not the case, and that's actually a little bit counterproductive to what's trying to happen. So again, dry is the best way for things to heal. Now, let's sort of take some of the incisions and how they're closed one at a time. If you have staples on the incision, usually those will come out about 7 to 10 days after they were put in. And at about day 4 or 5, you might notice that around the staple there starts to be a little bit of redness, and that's your body responding to it. Sometimes there can be a little purulence as well, or it looks like it's a little pimple there. Once the staples come out, that'll go away. It's not an infection, so really don't worry too much about that on its own. When the staples come out, we usually put these sticky white strips over it to reinforce the incision healing well. Those are called stereo strips. They can go in water too. Don't worry about it. They'll fall off in time. If you have glue on top of the skin, that glue sometimes can turn purple, and kind of like a scab, it can actually roll off your skin a little bit. So you can actually, where it's rolled off the skin, you can actually cut it with a scissor so that it doesn't get caught on your clothes, or you don't pull it the rest of the way off, or it doesn't really bother you. So if I take my finger and this is the incision and it's pulled up a little bit there, you can take a scissor and just cut that off. Now, a lot of times when there are sutures under the skin, there's going to be a knot under the skin. So you may feel this sort of like hard area, and sometimes that can be really itchy. That will go away in time. It's just that knot sort of being taken care of by your body and dissolving. It's annoying completely, but it will go away, and it's not something to be concerned about. Now, the sutures that are dissolvable that you can see, they will come off in 5 days, 7 days, a little bit longer, and they will do just fine. Now let's talk about stuff that can come out of the incision. Sometimes afterwards you can have a little bit of just fluid weeping out, and that's pretty normal. It can be straw colored and clear, and that's okay. Sometimes if it's a little bit cloudy or thicker and it's 4 or 5 days later, that can be a concern for an infection at the surgery site. And that's certainly absolutely something you should talk with your doctor about. And getting out in front of that is going to be a lot better than kind of waiting on that one. So if you see that, definitely let somebody know. Now, the general signs for infection are things like it's a lot hotter in one area, like it feels really, really hot. It's painful to touch, it's red, and it's really hard. And it may have some of that like pus leaking out there. Now, most of the time, an incision will not be infected the entire ways. It's usually just one little area. So again, if you have that concern, definitely talk with your doctor. Sometimes a day or two later, you can just have some blood kind of seep out of one of the areas. And if it's a little bit and it just comes out, that's fine. If it's constantly dripping, that is absolutely something that you should talk with your doctor about. Sometimes you can apply some pressure and it will just stop on its own in the same way like a bloody nose does, but it might be kind of painful, so do pay attention to that stuff. Right? Now, there are also concerns about bruising and swelling, and that's really, really common. And depending on where your operation was, some areas will have bruising that tracks in certain directions, and that's completely because of gravity. So let's say you had an operation in your groin or something like that. It's pretty normal to have some bruising on your scrotum, and that's going to be really weird and freak some people out. But that's because your scrotum is lower than your groin, and gravity is going to pull some of that fluid that way. And it's still bruising. Even though it's surgery, it isn't like you jammed your finger in a car door, but things still swell up and they bruise, so stuff is going to track that way. So do be ready for that sometimes. That's pretty common with hernia operations, actually. Now, stuff germane specifically to urology, when we talk about like circumcision things or scrotal surgeries, I'll tend to really try and tell my patients up front that they're going to deal with some bruising and they're going to deal with some swelling, and they may think that I'm like the worst surgeon they've met for the first week. Because if you're having a circumcision, I'm sorry, this is going to be gross, but your penis is going to look like a grilled bratwurst for the first week. And it will get better, I promise you that. But it's going to look kind of rough for a handful of days because it's going to be bruised and swollen and different from normal. Give it 3 or 4 weeks, it'll get back to normal, I promise. But that stands to reason that things do swell up. Now, some of the best ways to deal with this are some of the least sexy ways you can imagine. And we tend to all call this like a RICE protocol. So rest, ice, compression, elevation. So rest just meaning that we don't want you to be running around a lot right after surgery. And we will give pretty specific guidelines on what we want people to do. Most of the time we definitely want you up walking around doing normal activities of your daily living. But we don't really want you to be mowing the yard for 2 hours or playing basketball if you just had surgery 3 days ago. So use a little bit of judgment there. If you have specific questions, definitely ask your surgeon. But that's the rest portion. Ice is really helpful and probably really underused. A lot of people will rely on their narcotic medication or Motrin or whatever you've been given, but ice is going to be great, especially for the first handful of days. So definitely use this in sort of a 20 minutes on, 20 minutes off thing, and maybe have like 1 layer of clothing or something between the ice and whatever your incision is, just so that it doesn't harm the incision or your skin or cause any like frostbite or really cold burns, things like that. But specifically, if it's a scrotal thing or if it's a circumcision thing, a bag of frozen peas, frozen vegetables are great for this. And it's just because they're not big cubes, they don't fall off the side or anything, but they work really great. So I think that's a good thing to use. And you can use this for days on end, and it works really well. In terms of compression, if it's urologic stuff, we will usually have people in jock straps or compressive underwear. Sometimes if it's a different area of your body, obviously there might be things that they want you to use for compression. And you should, because the more the skin kind of stays tighter, the better those incisions are going to heal, and sometimes just the better outcome you're going to have. And if it's not full of fluid, it won't really throb, and that really takes away some of that type of pain that's really, really annoying. So the compression side is really important. It also keeps you from having what's called a hematoma sometimes, or really a collection of blood that's just causing everything to swell up. Now, the last part of this is elevation, and what that means again is just allowing some of that fluid that's in a different part of your body to come back to the main part of your body. So if we talk about like a leg, if you elevate your leg a little bit above your pubic bone, your abdomen, that fluid will kind of pull its way back to the main part of your body, and that'll remove some of that swelling that's happening. Same thing goes for the scrotum, right? It's such an unforgiving place to operate. It's elastic as all hell. Every guy knows that. And it's just going to fill up with fluid. And the same thing with your penis. So this is going to be a little weird what I'm about to say, but what I want you to do sometimes is, if you're dealing with this, throw a towel under your scrotum when you're laying on a bed or a couch, and get it so that your scrotum is up above your pubic bone, so it sort of goes like that. And all that fluid will move back towards your abdomen, and you will help use gravity in your favor as opposed to gravity being against you, which is what we want. Now, in addition to those types of things, we will obviously give you pain medication afterwards, and every surgeon has their flavor. Now, the narcotic stuff like Norco, Vicodin, Percocet, that stuff is going to be great to take away pain. The times I've had that, somebody could have sawed my arm off and I probably wouldn't have paid attention. So that's going to be great just to let you kind of go for a while. But eventually you got to get off that stuff, because it's not going to deal with the inflammation. It's going to keep you from being able to do your normal activities, and if you're supposed to do post-op care, especially with the orthopedic stuff, a lot of times the narcotics are going to keep you from being able to do the exercises that you need to focus on to do your best. So, ice and Motrin come in really handy in those types of situations, and talk with your surgeon about stuff that they recommend. Also, narcotics are going to cause constipation, so get out the prunes, get out the vegetables, get out the fiber, and actually ask for some medications to soften what it feels like when you have a bowel movement, because it's not going to be comfortable. So just recognize those things right up front. I think I've probably hit my time limit. I'm at like 12 and a half minutes, so some of you are probably asleep. I hope you found this helpful. Definitely send me your thoughts and your questions, and have a good night. Take care of yourselves. We'll see y'all soon, all right? Bye.